Let us learn now when and how to perform adult rescue breathing. Always begin with an ABC check. Following the 911 call, open the person's airway, check to see if the person is breathing, and if they're not breathing, give them 2 slow breaths. Once the 2 breaths go in, now check for signs of blood circulation. If the person is not breathing, but they still have signs of blood circulating, this means that the heart is still pumping blood around the body. But the person is not breathing. So ask yourself, what is the only thing the body needs? If you answered oxygen, you're absolutely correct. And giving repetitive oxygen is called rescue breathing.
Rescue breathing is given to someone who has stopped breathing but still has signs of circulation. By giving rescue breathing, you provide oxygenated blood, which can help keep the vital organs alive.
If the person is not breathing but has signs of blood circulation, initiate adult rescue breathing for respiratory arrest.
For an adult 8 years and older, give 1 breath every 5 seconds. Keep oxygenating the blood. Do this for about 1 minute, 12 breaths. A few things to remember when giving rescue breathing is to make sure the chin is the highest point of the face. This ensures an open airway. When ventilating, make sure the nose is closed. This will allow the air to go into the lungs. Use a breathing barrier if you have one available. If not, use the mouth-to-mouth technique. Look at the chest to make sure your breaths are going in. Each breath should make the chest rise.
Did you know the air you breathe out contains 16% oxygen and 5% carbon dioxide? This means when doing rescue breathing, you are still supplying enough oxygen to keep the person alive.
After giving rescue breathing for approximately 1 minute or 12 breaths, stop the rescue breathing technique and recheck for signs of blood circulation. In other words, check to see if their heart is still pumping.
If the person is still not breathing but has signs of blood circulation, continue the rescue breathing sequence. Continue rescue breathing until emergency medical personnel arrive and take over. You are too exhausted to continue. The person begins to breathe or vomit. The person loses signs of circulation. The area becomes dangerous.
Please pause the video and discuss the meaning of respiratory arrest and why we give rescue breathing.
Over 1 million people in Ontario taken to the hospital per year with a respiratory emergency. Anyone breathing less than 15 times a minute and in a coma needs respiratory assist only. Never give a beating heart chest compressions. There's less than 10,000 out-of-hospital cardiac arrests per year in Ontario, and the only time you give chest compressions only is for a sudden witnessed cardiac arrest because the blood is still oxygenated. Public Health Ontario has taught tens of thousands of people, if you're in a coma, labored breathing, pinpoint pupils, cyanotic, Cheyne-Stokes respiration, give them chest compressions only. All those signs prove that the heart's beating could be any of the hundreds of causes of respiratory emergency. These laypersons are doing is exactly what a nurse is instructed for them to do. So Ontario, the only place in the world that likes teaching people mass murder, and they're getting away with it. 234 doctors wrote a letter to Kathleen, Wynne, and Hoskins about it. There's no place in medicine that'll say do what Public Health Ontario does, because it's murder.